Hello and welcome to this session on the global context of supply chains. Today, we will explore the learning outcome, how globalization shapes the world of supply chains. This session introduces the key dynamics of global supply networks and examines how they influence modern business operations and decision-making. This unit is part of the OTHM Level 5 Extended Diploma in Health and Social Care Management. It is a Level 4 unit with 20 credits. Learners must meet all assessment criteria to pass. The unit involves 100 guided learning hours. Total qualification time is 200 hours. The aim is to develop strategies for equality, diversity, and inclusion. Understanding human rights in care practice is crucial. Promoting inclusive practice within organizations is emphasized. Balancing individual rights with duty of care is also explored. These are key components of the unit. The first outcome is understanding equality, diversity, inclusion, and human rights. The second is understanding systems promoting equality and diversity. The third is promoting these practices in real-world settings. The fourth focuses on managing risk and balancing rights with duty of care. These outcomes guide the learning process. The assignment includes 2 tasks. Task 1 requires a report on equality, diversity, and inclusion. Task 2 is an essay evaluating person-centered approaches. Both tasks are 1,500 words each. Completion of both tasks is necessary to pass. Task 1 involves defining key concepts like diversity and equality. It requires explaining legislation supporting equality and human rights. Models underpinning equality and inclusion must be explained. Barriers to equality and inclusion in health and social care are analyzed. This task is foundational for understanding the subject. Key legislations include the Equality Act 2010. The Human Rights Act 1998 is also crucial. The CARE Act 2014 supports these principles. These laws protect individuals from discrimination. Ensuring fair treatment is a primary goal. Developing policies supporting equality and diversity is essential. Staff training on inclusive practice is vital. Promoting person-centered care approaches enhances inclusivity. Encouraging respectful communication and cultural awareness is key. These practices foster an inclusive environment. The essay analyzes how promoting equality improves outcomes. It provides examples of promoting equality in the workplace. Explaining how to challenge discrimination is essential. Ethical dilemmas, balancing rights, and duty of care are analyzed. This task deepens understanding of practical applications. Ensuring individual autonomy while maintaining safety is crucial. Applying informed choice principles is necessary. Considering mental capacity when supporting individuals is important. Developing risk management strategies in care settings is essential. These aspects balance rights with duty of care. Respecting individual values, beliefs, and preferences is fundamental. Promoting participation in decision-making is important. Ensuring services meet diverse cultural and social needs is essential. Improving quality of care outcomes is a primary goal. These principles enhance person-centered care. Harvard referencing style is required. Supporting arguments with academic sources is essential. Providing in-text citations and a full reference list is necessary. Ensuring originality and avoiding plagiarism is crucial. These are key aspects of academic writing. Task 1 is a report of approximately 1,500 words. Task 2 is an essay of the same length. Assignments must be submitted in Word format. Submission is via learnerwork@ukversity.co.uk. Feedback is normally provided within 3 to 5 working days. Diversity encompasses recognizing individual differences. Equality ensures fair treatment and opportunities. Inclusion involves integrating diverse individuals into communities. Discrimination is unjust treatment based on differences. Understanding these concepts is foundational for promoting equality. The Equality Act 2010 prohibits discrimination. The Human Rights Act 1998 protects individual rights. The CARE Act 2014 supports fair treatment in care. These legislations form the legal framework for equality. Understanding them is crucial for compliance. Models underpinning equality include the social model of disability. The medical model focuses on impairments. The social model emphasizes removing barriers. Inclusion models integrate diverse individuals into communities. These models guide inclusive practices. Barriers to equality include prejudice and stereotypes. Lack of awareness hinders inclusive practices. Inadequate policies can perpetuate discrimination. Cultural differences can create misunderstandings. Analyzing these barriers helps in developing solutions. Policies should support equality and diversity. They must be clear and actionable. Regular reviews ensure policies remain relevant. Staff should be trained on policy implementation. Effective policies foster an inclusive environment. Respectful communication is key to inclusion. It involves active listening and empathy. Cultural awareness enhances understanding. Training can improve communication skills. Promoting respect fosters a positive environment. Challenging discrimination requires awareness and action. Reporting mechanisms should be in place. Education can change discriminatory attitudes. Support systems aid affected individuals. Taking a stand against discrimination is essential. Through strategic implementation, equality, diversity, and inclusion can transform care practices. Understanding human rights and promoting inclusive practices are essential. Balancing individual rights with duty of care is vital for success. If you need any help, just WhatsApp 07484361688. Our team is always ready to assist. Thank you for your attention, and we look forward to seeing you in the next session.